Alrighty, welcome back to the Millennial Thermom YouTube page and online community. I'm really excited for y'all to hear from Dr. Lauren. She's a pelvic health physical therapist here in San Diego. She's going to share her wisdom. So can you share a little bit about yourself and what you do?
Yeah, for sure. So I am here in San Diego. I own Thrive Physical Therapy with my husband, Aaron, who's also a physical therapist. He doesn't do pelvic floor physical therapy for women like I do. But we've been doing it for, did I already say this? We've been doing it for 12 years. We've had our practice for like 6 years. But yeah, I work primarily with people who are pregnant and postpartum. Those aren't the only people that have pelvic floor issues. You can have pelvic floor issues and not be pregnant or postpartum. But that's just what I specialize in and what I love. And I guess we'll talk a little bit more as we go about what the heck pelvic floor is, but pelvic floor are the muscles that live in your pelvis and have to do with like pee, poop, and sex. So that's my jam. And I kind of got into it like in the very beginning of my career, like a couple months into it. Just honestly, I was just like pissed off that there was not better care for these people who were straight up delivering life to our world through their bodies. And then we were like, cool, go back to work. Like, and also be like, kind of at a deficit, for lack of a better word, as your body's trying to heal, but then you're like, go back to work and lift up this awkward like car seat and like, some people have pain with sex and some people were like leaking when they were sneezing and stuff and or laughing with their friends. So I'm like, there's no, like all of these like crappy things that were happening that don't have to happen though, or they don't have to continue. We'll talk about it more, I'm sure. They're really common to happen, but they don't have to continue. And I just was just like literally pissed off about like that was just the norm and everyone was just cool with it. And I was like,
yeah.
nah.
And then it doesn't help that like it didn't really come up ever in my visits with like my OB for some reason. At least not that like let's schedule you for this at all. And then
Yeah, I always thought that was so weird because like I could actually understand kind of like sorry if you're a urologist listening to this or you're a guy, whatever, but like I could understand like urologists not wanting to refer to a pelvic floor physical therapist because like maybe we might take quote unquote take their job, right? Because if they're going to be like, hey, here's an issue with your bladder, we're going to help you with it with medication, versus the pelvic floor physical therapist is going to be like, here's an issue with your bladder, let me work with you with your muscles and all these other things that aren't medication. Like I could see that, but with like an OB or even a midwife, I have a ton of midwife friends, like it wasn't normal, but like I'm not going to go and take an OB's job. Like I'm not I'm not doing that. So it was really weird. I think it was 2008 though that like it was in their like journal, their I keep thinking of JOSPTR journal, but their professional journal, that it started coming out with like how helpful it is to see a therapist and a physical therapist, and even just having phone calls for like decreasing like postpartum depression and stuff. It's just so it's been out there now, but it's like just slowly coming around to it. Because 12 years ago when I started, this was not the topic of conversation for most people. So I'm so super stoked to be talking about this now. I'm just like getting it out to more people.
Yeah, definitely. And I think that's why once I got into the postpartum world, I realized like I do not have all the tools for my postpartum clients. Like I can't guide them through what's going on in their pelvic. You know what I mean? Like I can't lie and pretend I do, but
no, but at least like they get to talk with you about it. And like I was just talking about this with a patient yesterday of like how much stuff comes up in my physical therapy appointments with them that like I can't go into like much further than I would further into somebody like you, right? But they're so connected, especially in such like a big event. It's gonna affect you both mentally and physically, and that could be for good and bad and in between and all this stuff, but they're for sure connected. So definitely. I'm glad you know now, so you can help all your people.
Yes, definitely. Like, and I know that like for myself, I'm 11 months postpartum, and that was one of the areas that I was like, let me try to get something on the calendar. Because it's so easy to neglect our own needs, especially in the in postpartum, where we're just like surviving, right? We don't even pause enough sometimes to think like, how is my pelvic floor doing? What kind of support, right? So it's like a whole mindset shift of like, no, we are also deserving of care, and that includes our whole body, mind, body, spirit, all the above.
All of it, yeah.
So cool. So could you share a little bit, like, what are some of the main reasons that people might come for you for support, or a reason that you wish people would come to you for support if they
Right, so
don't?
the main reasons people come to me are because they are peeing their pants. Usually they're leaking, you know, like
Mhm,
whether it's because they're laughing or just like randomly,
mhm,
or they like feel like they have to pee really often.
mhm,
They are having pain with penetrative sex,
mhm,
or even just regular, just touch on the outside too.
mhm,
They are having prolapse or like heaviness in the vagina or rectum,
mhm,
or feeling like something you got to like push up there, or it just feels kind of heavy. Um, and then more and more now people are coming for birth prep, because I have this whole program, so now it's out there. It's great, to, you know, stay strong during pregnancy as your body's like making all these shifts and like having to figure out how
mhm,
to walk and stand and move with this like ever-changing body,
mhm,
um, that is like intentionally becoming a little bit more mobile, right? Because it's
mhm,
supposed to. And at the same time, we need to be strong to hold all of that new weight. And then also straight up birth prep, like, what are you going to do in the room? How
mhm,
are you going to breathe? What kind of positions are good for you? How are you going to push? Because interestingly enough, I've like, you know, if people are interested, we'll test their like ability or like their style of pushing, like
mhm,
intravaginally. I'll put my finger in and be like, okay, push. Like if you're gonna push your baby out, what does that look like? And some people will do like a, you probably heard the term Kegel,
mhm.
like the pelvic floor contraction. We call them push-ups here. But
Love that.
they'll like do a push-up instead. So we kind of like settle that, get that figured out. Not everyone has problems with that, right? But it's just like if you want to know, that's
Mhm,
what we work on. And then like their partners will come in if they have a partner, and we'll go through different positions too. I did a lot of studying like postpartum doula work, and just have like doula friends, so we integrate that kind of stuff too. So that's what people usually come to me for. And what I want them to come to me for are all of those things, but before they're an issue, right? So
mhm, mhm,
like the program I was telling you about starts at like around 20 weeks pregnant, and there usually is not a lot going on. So that's perfect, because then we're like,
mhm,
hey, this is what we're going to work on. And if you're interested, we can talk about some things that could happen postpartum so we can get ahead of the game. You know,
mhm,
not everyone wants to know.
mhm,
Honestly, not everyone wants to know that maybe leaking pee in your pants might be a thing that happens. Like physiologically, it kind of makes sense that that happens. You know, like
yeah,
that was, if
yeah.
you had a vaginal delivery, that was a lot of pressure. If you had a belly
Mhm,
birth, you still carried that baby for 10 months. So that's still a lot of pressure on your bladder. So
mhm,
like it makes sense for that kind of stuff to happen, but it doesn't have to last. So
mhm.
I'm just like, those are the things that people see me for. And what I want them to see me for are the same things, but like before they actually happen, they're just kind of like, hey,
Yeah.
how's my pelvic floor doing so I can prevent these things from happening?
Yeah, yeah, I love that. I think I'm very big on the preventative care right now. And I think that's one thing about therapy that like sometimes struggle with. It's like, why do we have to wait until there's a diagnosis, right? For people
Yeah,
to access this level of support. And hence why like I like to put things out into the world like videos and like community spaces and events and workshops and like all these other things that's like, okay, you're about to become a parent. Let's talk about this so that we
yeah,
don't have to wait until your debilitating anxiety is taking over. Right. It's like, no,
100%.
like we can all learn breathing techniques and relaxation and mindfulness before we're toppling over.
Yeah, I was talking with some people from an older generation, and I was telling them how I go to therapy. My husband and I go to therapy, and they're like, "Oh my gosh, what's wrong?" And I'm like, "Nothing.
Mhm,
Like,
mhm,
we're just going like to prevent stuff, or sometimes there is stuff wrong, right? But like, or wrong. I'm like, nah, it's just cool. I like to go. Like,
mhm,
it's really,
mhm.
I like personally, like, let's talk about the hard stuff so it
Yeah,
doesn't become harder stuff,
yeah.
or talk about things that we might not even realize are affecting us. But it was
Mhm.
just interesting, like oh, what's wrong? Like you're in therapy. Oh
Yeah,
no. And I was like, oh no, no, I
yeah,
think it's great. It's
yeah, yeah.
fun. I like it.
Yeah, I definitely feel like there's this movement towards like our generation just like making this a focus again, like mental health. And you don't just automatically most of us don't just automatically wake up with like all the coping skills in the world, right? And like all this insight into our childhood and like how it's repeating in the present. Like
Yeah.
that takes some deep work.
It takes some deep
Yeah.
work. And like, yeah, we weren't taught that by our parents because they weren't taught that. So it's not even like their fault, right?
Yep.
Their thing is like, not everybody's parents, all right? I don't mean to be like judging everyone's parents or like, it's just different. And when our kids are grown, when they're grown, who knows what they're going to think of our
Yeah.
our coping strategies.
I know. Like,
Oh,
I know.
oh my gosh, we'll find out.
I feel like I'm already teaching my daughter like deep breathing just with how much I do it. And she
Yeah,
just like laughs at me, and I'm like, that's okay.
that's okay. It's gonna come in. It's gonna come in
It's
helpful one day.
generational wealth these days. But yes,
Exactly.
so I definitely love that preventative approach for sure. And what would you say that you love the most about what you do?
I think like my clients and patients like having that aha moment of like,
Mm,
oh, I don't have to have pain. I don't have to have leaking. I don't have to have this heaviness. Like
mhm,
I don't just this is off the top on the top of my head right now because I've had a couple of patients in a row that have had like quote unquote frequent UTIs, but they're not like when they go get tested, it's not like actually bacteria, like it's not actually a
mm,
UTI, but they have the symptoms. And so they're out here thinking like they got to take all this medication. And look, if you have a UTI, like you have to do your medication. But tight pelvic floor muscles can like mimic UTI symptoms often.
mm,
So sorry, that's very specific, but it just has been happening a lot this week. And like that realization of like, oh, I can do something about it, or like this makes sense. Like it's not everything is so sinister and so like, oh, you have to take a medication for that, or you need a surgery to lift your bladder, or like,
mm,
like I don't know, you're never gonna have penetrative sex again because you have this scar that you had tearing. Like,
mhm.
yeah, we can work on that. And it's just
Yeah.
so nice to see that like that relax a little bit, even though there's work to be done. But I
Mhm.
think most of my clients at least are like, okay, there's work to be done, but there's work to be done. Instead of we've, as women, have, I think, kind of lived in this like gray area of medical help where it's like, well,
Mhm.
that's what happens.
Yeah,
And there's not a lot of explanation, right? So it's like cool to give them that. And then just the confidence and like the ownership that it like brings them. I'm just like,
yeah.
oh, yeah. So we like, you can't see, but in our office, we have like a whole gym here, right? Because like motherhood is not for the weak. Like you
Yeah.
got to lift
Mhm.
some stuff, like
Yeah.
actually physically, right?
Yeah.
Lift stuff mentally and physically. And so we have a whole gym there and like just to see them like pick up heavy weights that they didn't think they could do, right? Because some doctors are like, don't lift over 5 pounds. I'm
Mhm.
like, okay, how much does your kid weigh? Or your
Mhm.
other kid if you're pregnant, like there's some stuff you have to do. There
Yeah.
are precautions, all that stuff that we keep in mind and take note of and all of that. But
Yeah. Yeah. That's
it's
awesome.
just cool to see the strength because we know that moms are strong. We know
Yeah.
that, but it's not always out there.
Yes, yes, yeah. Yeah, I love it's like the more holistic approach. And I think that that's what I've really enjoyed about doing these talks. It's like hearing how different people approach healing and like symptoms in the body and giving some
Mm-hmm.
hope. I'm like, there's this different way to address that. Are you willing to try it? And knowing that
Yeah.
there's hope.
Yeah, there's hope. Are you willing to try it? That's so great. Like, are you willing? Like, this might not be it. You might need some medication to help with your overactive bladder, right? But
Mhm,
like, if you don't, and it's just because you got a tight pelvic floor over here on the left side and we could like fix that,
mhm.
like, let's just do that.
Yeah.
But people have to know that that's an
Yeah.
option. So thank you for
Yes, of
making this,
course. Yeah.
putting this out here.
Definitely. I know I had no clue about it at all. And I feel like now that I'm like postpartum, like sometimes I'll just like feel towards my womb and like I have such like a greater appreciation for like everything that my body went through. But
Ooh.
I wasn't thinking about that when I was pregnant. I was more focused on like my daughter, right, coming out. And I think that like I am also learning like, oh man, like we do live in a society where most of the focus is like, how is the baby and
Mm-hmm.
where's the money? So the room
Yeah.
for mama's needs isn't always in the focus, so then we feel like guilty or selfish if it's like how am I doing? Right. And it's like, we can love our babies and love ourselves.
Yeah, you kind of honestly, you can love your baby better if you love and take care of yourself,
Yeah.
right? So like with the program that we have, that's why we have a program. Like we
Mhm.
give you dates to come in. You don't have to do those dates, but it's just like I do better if you tell me when to show up
Mhm.
versus like, oh, come back, whenever
Yeah.
you want. I'm gonna be like, no, I'm good. I'm good. I got to do this thing. I got to do this thing for
Yeah.
somebody else and this for somebody else. So
Yeah.
that has been really helpful, I think, in just like reminding my clients, my moms to put themselves on the calendar once a
Yeah.
month, you know,
Yeah. Definitely.
like
Yeah. Yeah.
something.
And I know I didn't prep you for this, but you got it.
Oh, okay.
Can you share a little bit of just like what the pelvic
Yeah.
muscle is? I don't know how to
Yeah.
explain
Yeah. All the
it.
muscles.
Yeah,
For
I know you got a
sure.
little visual back there.
I know. Here, let me
You can
grab it.
see.
You want me to grab it?
Yeah.
I think it'd be good. Okay, hold
Yeah. So to the people and everybody get in touch with your
on.
pelvic
Ooh, look,
area.
I'm dropping things. Okay. Sorry, I'm gonna put these back in. Okay. Sorry, my husband's treating next door and I don't want to hear that. It's throwing me off. Okay. So the pelvic floor, it kind of should be called the pelvic bowl because it's like a bowl of muscles inside of your pelvic bones. So here's your pelvis. These are all our organs and they're all jacked up because I dropped them just a second ago. So I'll put them back in order. But here's your pelvis, right? So if I'm like standing like this, that's my dog, Muff. I'm standing like that, right? So then these are the tops of your pelvis. This is your pubic bone. And then like if I turn it around, this is your sacrum, that big bone in the back.
Okay.
The tops of your pelvis right here. Some people say the top of your hip, but that's not your hip. Your hip is where the leg goes into the socket. So this is the top of your pelvis, sacrum. This is your spine. This right here is your tailbone. Okay, so I'm gonna turn it back around. And if I was laying on my back with my knees up,
Oh yeah.
right, we'd be looking up the vulva. I brought this other one so you could see like if the skin was on here. Right,
Okay.
here's what it would look like with the skin. Okay, and you can see the inner labia. So the skin is obviously taken off of here. And so we have 3 layers of the pelvic floor. The first one are like these muscles, and they're more responsible for closing. So this is the vaginal opening. This is the urethra, the pee hole. This is just the little head of the clitoris. The clitoris is way bigger than just the little head. It's actually, this is a whole clitoris. We could have a whole session on that, because that's super fun. But that's just the head of it. Here's the one arm of it and then like a leg of it. And then here's the anus. And there's that space between the vagina and the anus and the 2 butt bones. Okay. So that first layer is right here and it's mostly responsible for closing. So if we do like a Kegel, like I was saying, which we call push-ups here, if you do a push-up, you're going to close and also lift, right, with those muscles inside of the pelvis. You're going to close here and then get all the organs out. Then this inner layer is going to do the lifting part. So I'm going to take this layer off. This is the first layer. The second layer I skipped over. It's kind of like fascia and sphincters. Again, I'm going to skip over that too and just go straight to the third layer. And that's the one that does the lifting. So we close and lift with a push up. So this all holds in, okay, it holds your bladder, your bladder, your uterus and vaginal canal. There's the little fallopian tubes and the ovaries, and then your poop chute, your colon, rectum, anus. So it all goes in here, all stacked on top of each other. I'm going to take it out so you can see how they are in here. Bladder right under the uterus. So like when you're pregnant and your baby's like jumping on your uterus, on your bladder, that's probably why you got to pee so much. And then your colon, your rectum. Okay. Like that.
Awesome.
So in the very beginning, I said I work with pee, poop, and sex. That's why. Your
Yeah.
pelvic floor muscles hold all of the things that are related to pee, poop, and sex. So they support them and they help them function as best as possible.
That's awesome. Yeah, thank you for that visual. I think it's how I literally was like like holding my back and the whole everything when
Like,
you were doing it. It's like that body awareness, right? Which is funny because as a therapist, we always help people like do body scans, for example,
yeah,
right?
yeah,
Like
yeah.
become aware. And
Like,
even that, just being aware of like, what am I feeling like down there? What am I feeling here? What am I feeling up over there? Even that, like practice in itself is already like a method of self-care, right? It's just like
oh, totally.
connecting
Like,
back to you.
yeah, a lot of people don't have like a connection there for whatever reason. There's so many reasons to not have a, like if you're doing that scan and it goes kind of like blank when you get to the
Mhm.
pelvic floor region, that's really common. It's
Yeah.
also very common that there are all of these um messages that we've heard to make us forget about it, like
Yeah.
shame
Mhm.
or abuse or periods are nasty
Mhm.
or that it smells like, okay, a vagina smells like something it's supposed to,
Yeah.
but like that's not what we were taught. So
Yeah.
anyway, when you do those scans, yeah, that's like so helpful. And the people who though can't even, like if you do the scan and can't access it, sometimes you literally need to put a finger on it. And
Mhm.
that's where like pelvic floor therapy can come into play. And of course, if you're comfortable with it, we can go in and put a finger on it and be like, this is
Yeah.
where it is. This is where that muscle is. Because if we do internal pelvic floor work, we put I can't get my finger in this thing, but
Mhm.
insert a finger here with a glove and lube and touch the muscles to help you identify
Mhm.
and map all of that.
Yeah, yeah. And I appreciate you like just being so open about this because I feel like this is what we need, right? Because I think, for example, like I think pregnancy was the first time in my life that I was like, oh my gosh, now I have to be acquainted with everything, right? Because it was like a ooh topic. It was
Yeah.
taboo, shame, don't talk about it. And then I feel like pregnancy is the first time you're discovering this. That can be difficult to just like
Yeah.
process all that at once, right? But there's
Yeah. And
support to do that.
the only thing you ever learn about it before that is that it needs to be tight and smell good,
Yeah.
which let me tell you something. An overly tight pelvic floor is not the business. That is not, it renders it weak and like non-functioning. And smelling good, you're not supposed to wash it. Don't wash it. It's self-cleaning. You could throw off
Mm.
your pH. So it's just like the only things we do learn about it are straight up wrong.
Yeah, yeah, yeah,
like,
yeah, yeah,
not the only things, but like a lot of them. A
yeah,
lot of
yeah.
them are.
And I think that's
So
why, like, knowing that there's like professionals out here who like do this for a living, love talking about it, will not
love
judge
talking
or
about it.
shame you, for it. I think I think it's very similar to mental health, right? Like, as a therapist, I'm like, tell me all your deepest,
Yeah, you're like,
darkest
I've
like
heard it
thoughts.
all. Like, yeah.
Yeah, it's
like,
like this,
don't
you're
be
safe
embarrassed.
here. Yeah, so I really, really appreciate that.
Yeah.
So to wrap up, could you share what you wish every parent in the postpartum season knew about their pelvic floor health?
Um, when you say like parent, it also like makes me think about like if you have a partner too. And I think what I'm thinking of right now, um, applies to your pelvic floor, but it also applies to just life in general, like especially in the postpartum time, is just like be appreciative of the stage that you're in right now. And if you have um the knowledge to feel like safe and comfortable in that stage, then it's a little bit more doable. But be appreciative of the stage you're in now, while you can also look like towards the next stage. So like, for example, early postpartum, where I'll use myself for an example, I had a tear. Whoa, that was a lot to do. It was very uncomfortable to sit or to just relax. I wanted to get up and do stuff. But like, if I kept focusing on like, oh, I got to get up and go over there, I got to walk, I got to work out again, or get my core back, or get my pelvic, like, then you miss the whole the whole time of like, oh, I'm I'm meant to be laying down with my baby and
Mhm,
chilling. And
mhm,
I wanted to appreciate that stage without like overshadowing it with like the next stage. And that can go like for my husband too, right? He wasn't dealing with pelvic floor issues, but trying to appreciate this stage of, whoa, it's kind of crazy. And also, whoa, this is cool. We're spending so much time in our house and we don't know what time it is. Like it's
Yeah.
just different because it's gonna be different next week. You
Yeah.
know, I made a reel about like appreciating the smushiness of your belly early
Mhm.
postpartum. Because girl, I was like, oh, this feels so good. Like I
Yeah.
loved it. And so many of my clients are like, how can I get my core strong again? How can I get it tight again? And I'm like, whoa, I
Mhm.
see you. I appreciate you. It's great. I want you to be strong too. And right now is not the time even for your core to be strong. So instead of skip over that, like how good does it feel though for your belly to be not stretched out anymore and like itchy or
Yeah.
whatever, right? Like take that second. It doesn't have to be for long. You can still think about the next thing, but I I think that's my thing.
Yeah, I love that. It's again like being present in the moment without jumping forward. And I do think that the pressures of bounce back, right? They don't
Bounce
help.
back culture.
It's
No,
it,
not at all.
it yeah. And it's like when can you go out there and be productive again, right? We have to consciously be like, nope, this is where I'm meant to be, and this is where I'm gonna be. And
Yeah. This
appreciate that
is
reminder.
yeah.
Yeah, awesome. Well, how can people be in contact with you, your services? Where are you? Yeah, who do you have?
Um I'm mostly on Instagram, not as much since I had a baby a year ago, but I am still on there. So Instagram, I'm Thrive Physical Therapy SD. We're in San Diego and like Bankers Hill if you're local. You can also, our website is SD Thrive. It's like a little backwards from our Instagram handle, but whatever. And then you can call us, you could text us, whatever. But for the easiest is like check out our stuff on Instagram. Um, Hit up the stories. I'm actually I need to put some stories up right now. I have but this is great. I can talk about this.
Yeah.
You can, that's where you can find us mostly.
Awesome, awesome. And then your services, is it all just in-person services? Do you have any virtual resources?
Yeah, I have virtual resources. So virtual like this, like we can do a session because so much of it is education.
Mhm.
And a lot of like we can tell a lot virtually. So with virtually, you don't have to be just in California. It could be wherever.
Awesome.
And then I also have, oh, I should send it to you. We also have a whole education like webinars. It's called Muff and Stuff. Muff, a dog. She
Oh,
was named after like Muff, the pubic hair,
oh, that's
because it's
funny.
very on brand. So we called it Muff and Stuff, and there's 4 different modules, and there's like teaching about diastasis recti, like the core, like separation, pelvic floor, just 101, leaking and prolapse, and then the last one is called that good, and it's about like inner intimacy and stuff postpartum.
I love
So
that. Yeah, that's
yeah.
awesome. Thank you so, so much.
You're welcome. You're welcome so much.
Awesome.
Thanks for having me. I'm so happy
Yeah.
to do this.
So I'll be putting your information all over this video so that people can
Cool.
reach out. But yeah, I hope that this brings awareness of like another part of healing that we deserve. Yeah. So
Yeah.
thank you again
You're
and
welcome.
reach out.
Cool.
Okay, bye.
Bye.